Welcome to our channel. Today we are going to see about cholinergic drugs, their receptors, pharmacological actions and side effects. Cholinergic drugs is also known as cholinomimetic or parasympathomimetic. These are the agents which produce similar actions to that of acetylcholine, either by directly interacting with cholinergic receptors or by increasing availability of acetylcholine at these sites. So cholinergic drugs, in cholinergic agonists, there are two categories. One is choline esters and another one is alkaloids. Choline esters consist of acetylcholine, methacholine, carbachol, bethanychol, and alkaloid consists of muscarine, pilocarpine and aricoline. So now we are going to see about cholinergic receptors. There are 5 cholinergic receptors. One is M1, M2, M3, NM and NN. And the location of M1 is secretory glands and the function is sweating, salivation, stomach acid secretion and lacrimation. The M2 receptor location is present in heart and the function of M2 receptor is it decreases the heart rate. So the decreased heart rate is known as bradycardia. The location of M3 receptor, it has two locations. One is smooth muscle, that is smooth muscle present in gastrointestinal, genitourinary and respiratory smooth muscles. So these smooth muscles, M3 receptor produces contraction of smooth muscles that leads to diarrhea, bronchospasm and urination. So another M3 receptor is present in pupil and ciliary muscles of eye. So this produces contraction of circular muscle of iris that leads to miosis, spasm of accommodation, increased flow of aqueous humor. Next receptor is NM. It is located in skeletal muscle end plate. It causes contraction of skeletal muscles. And last receptor is NN. It is present in autonomic ganglia and adrenal medulla. It produces secretion of epinephrine and it controls ANS. Next category of cholinergic drug is anticholinesterases. Anticholinesterases is again subdivided into reversible anticholinesterases and irreversible anticholinesterases. The reversible consists of carbamate and actidine. Carbamate contains physostigmine. Physostigmine is also known as E-serine, neostigmine, pridostigmine, edrophonium, rivastigmine and donepezil. And actidine contains tacrin. So the irreversible anticholinesterases, it is again subdivided into organophosphates and carbamates. Organophosphates has difloss, which is also known as DFP, ecothiopate, malathion, diazinon, tabun, serin and soman. This tabun, serin and soman comes under nerve gases for chemical warfare. Malathion and diazinon comes under insecticides. And carbamates. Carbamates contains carbaryl, that is sevin, and propoxar, bagon. These two comes under insecticides. Now we are going to see about uses of indirect cholinergic agonists, that is anticholinesterases. Uses of anticholinesterases. First use is glaucoma. In glaucoma it is used which drugs? Pilocarpine and physostigmine. Next drug edrophonium. Edrophonium is used to test myasthenia gravis. Neostigmine and pridostigmine is used in the treatment of myasthenia gravis. Next, neostigmine. Neostigmine is useful in post-operative paralytic ileus or urinary retention. Then neostigmine is also used in post-operative decurarization and it reverses muscle paralysis. Next drug, edrophonium. Edrophonium is used in cobra bite and it prevents the respiratory paralysis. Another drug, physostigmine, it is used in atropine poisoning, and the drug donepezil, galantamine, rivastigmine, it is useful in Alzheimer's disease treatment. Next, physostigmine. Physostigmine is used in the overdose of tricyclic antidepressants and phenothiazines. Side effects of cholinergic agents. Side effects of cholinergic agents is due to the overstimulation of parasympathetic nervous system. So what are all the side effects? First, in cardiovascular system, it produces bradycardia, that is decreased heart rate, hypotension and cardiac arrest. In central nervous system, it causes headache and dizziness. In gastrointestinal system, it produces abdominal cramps, increased gastric secretion, nausea and vomiting. In respiratory system, it increases the bronchial secretions and bronchospasms. Other than these systems, it produces lacrimation, sweating, salivation, and loss of binocular accommodation, and it causes meiosis. Now, organophosphate poisoning, also known as anticholinesterase poisoning. So, this is mainly due to the toxic effect of irreversible anticholinesterases. These agents are lipid soluble. It can enter the body through eye, skin, respiratory system, and also through gastrointestinal tract. So, it can also caused due to organophosphate insecticide, that is parathion or parathion, and also due to nerve gases, that is sarin, tabun and soman. These agents cause excessive cholinergic stimulation, that is muscarinic stimulation excessive these agents cause, and neuromuscular blockade. So what is the treatment of organophosphorus poisoning? So first is the termination of poisoning. How we can terminate the poisoning? Through fresh air, and we can wash the skin and mucous membrane with soap and water, and through gastric lavage. So next step is atropine. So to counteract the muscarinic effect, atropine is needed. So 2 mg in IV for every 10 minutes till pupil dilates, maximum up to 50 to 100 mg is given. Then next one is pralidoxime. So pralidoxime is a cholinesterase reactivator. It causes cholinesterase to release the enzyme acetylcholinesterases. Thank you. If you like this video, you can subscribe, share and like and comment it.